We'll turn next to hear from Robin Caruso. She's the Chief Togetherness Officer at CareMore Health. CareMore is a subsidiary of Anthem, serving Medicaid and Medicare patients, and it's recognized as one of the most innovative models of care delivery for people with complex needs. And Robin is here with us today to share really their first-of-a-kind effort to combat loneliness in the U.S. Robin?
Thank you so much. And I'm having problems seeing the slides, so I don't know. I didn't see Julianne's at all, so I'm trying to make sure my slides are up. So if you can assist me with that as I introduce our program a little bit. So basically, I'm still not seeing them.
We can advance. We can advance
okay.
For you. So we're on slide 1 right now.
Okay. Thank you, because I'm still not seeing that. So I'll go for my slides. So in 2007, in May, we launched our Togetherness program at CareMore. And my background at CareMore is I came to CareMore 11 years ago because no matter what the doctor's medical interventions they were doing for our members, there would be a subset group that kept going into the hospital. And it was because of all the psychosocial issues that were going on. And so from that point of view, that's where we began to deal with the social determinants of healthcare. And one of the earliest things that we would look at the patients we were seeing were the people that live alone and have very little social support. And you can go to the next slide. Julianne kind of talked about why we decided to not only create a program for loneliness and isolation because of all the health risks, that we wanted to tackle it and address it just like you would do a disease management program for diabetes. And so that's something CareMore is very proactive in managing chronic diseases. Actually, if you go to slide 3, it talks about, we did a survey with our members that we asked them, what kind of things do they want to see their healthcare providers do. And not only did 27% of the seniors said, hey, we want our doctors to connect us to programs and activities in the community to stay helpful, but we want them to give us specific programs to really help manage our health issues. So we began the Togetherness program. You can go to the next slide. And what we did there, we had 3 main goals. It was we really wanted to re-engage them in their health care. Some of them may be going into the emergency room for their health care. They were showing up, but they weren't really engaged in their health care. So, that could really be described, I think, best in a story of working with one of our members who actually self-referred into our program, talking about with his long chronic mental illness, how he was so lonely, didn't have anything. But it was very clear as we started reaching out and calling him that he was very disengaged from his health and that he wasn't even keeping his appointments. And since we've been calling him and just having a friendly conversation, which was different from most type of healthcare outreaches, that some of the patients were a little taken back, were even asking to talk to my staff supervisors, thinking, you're not calling to ask me to come in for a health screening or my mammogram, but we were just calling to have a friendly connection. And so by having that friendly phone call, he began now caring a little bit more about himself, and he started showing up to his appointments. And had not missed, and behavioral health said not only had he not missed any of his appointments, but he started saying, you know what, I want to try my medications now. And 6 weeks later, my staff was so amazed to see that he was now carrying on normal conversations. And I reviewed his chart not too long ago, and he's out riding his bicycle when we called him sometimes. Sometimes he's out, he had made a new friend. And then he was taking care of his dental needs, something that he hadn't done in a long time. So really by just having that friendly phone call and calling and connecting to our members, that we want to get them re-engaged in their health care. The second piece is really connecting them to those community-based organizations for socialization, but also for all those other issues that Don talked earlier about, the social determinants of healthcare. My staff are called connectors, and it's not just about them having that great connection and having that great phone call, but it's also about connecting them to those community-based organizations. Two of the number one resources that we refer people to are transportation and Meals on Wheels. But we're also trying to get them engaged in something like if they're homebound, a senior center without walls. If they're able to get out and we want to get them socializing, getting them engaged at a senior center. And we had one particular gentleman that sometimes after one phone call from my staff, they'll say, I didn't realize until talking to you how long it's been since I went out. And we had mailed him a calendar just for the local senior center, and he said, on Friday, they play music. I think that's something I can do. It's not too intimidating. And so he, that next Friday, he called, we arranged for public transportation, and he called from the bus. He was, really nervous to go. But he said, I can hear your voice saying, I got this, I can do this. So it was more than just referring him. Julianne kind of alluded to that. You can offer them support and resources, but it's really kind of hand-holding them to get them connected to those resources. And then he let us know on Monday at his experience when he got there, it was kind of like high school, that all the ladies were dancing on the dance floor and the men were sitting around and just watching. And when he got there, he said it was so hard to get there that he found himself out on the dance floor, the only man out there dancing, and that he made quite a number of friends. And I got to meet him at one of our social events that we had, and how much that just starting going to the senior center has impacted his life. But he was nominated to be the president of that organization, and that how just getting him connected to one community resource such as the senior center, how it's got him reengaged and given him more purpose and meaning. And then the third goal that we have is increasing their physical activity. I think this was some of the things that was looked upon by Dawn and by Julianne, but getting people out and exercising, the impact that it can have on their health. We have gyms like Nifty After 50 or Silver Sneakers, and the gyms are very socially based as well. And so in this one particular case, and calling our members, it doesn't always happen overnight. I much sometimes use the analogy of our program in dating, that on that first date, you can't tell the person you're going out with all the things that they're doing wrong and what they need to do. You really have to have that relationship. So this particular member, it had been 4 months into my staff calling her, and her barrier of leaving her home was she was in increased pain, and she used a walker, and she was a little embarrassed for people to see her out using a walker, and so that had kind of led to her isolation. And so one of the things is that my staff had been talking to her and sending her calendars, and he finally said, I couldn't help but believe that if you were to get out and do some exercise, you might feel better. And even though she had already said to him, I've been there, done that, and it's all I can do to just get dressed and go to the doctor, she said, I know you really care about me, and if you think this would help me, I'm going to try it. And fast forward about 6 weeks later, she was actually not only not in pain anymore, but she was also now not using her walker. And then I got to meet her at a social event, and she had described her life that she really had been a caregiver, taking care of her mom from the time that she was 14. And then when she got married, her husband, taking care of him. And so she had spent the majority of her adult life up until now into her 70s where she had been a caregiver. And since her husband died 2 years ago, she really hadn't gotten out and socialized. And that by going to the gym, it didn't only help her physical health and her physical well-being, but she now had friends from the gym coming to her house, and she was going to their house. And she said, Robin, I haven't had friends like this since I was 14. So that kind of takes me to our next slide and kind of taking a look, what do our patients look like and who are the people that we're looking for? Well, we're focusing, our first outreach just included people that lived alone, but then we knew that people that live with others, they live with family, but they spent the majority of their day in isolation, that we begin to include that. And then the other group is caregivers with little support. And that's kind of where this member had been before she got out and began exercising, and she had been such a caregiver. And so these are also people with very poor social support systems. They've also are referred to our program because they actually self-report that they're lonely. One of the things that we did when we started our program, we did a lot of education with our clinicians that we now include the loneliness scale within our medical records so that anyone would be able to refer, any clinician, every time you touch bases with someone that, if they come in and they're coming in for their diabetes, we're not just assessing that, we're also assessing to see what their support systems are like and if they are reporting self-loneliness. Then we also have a big focus on new widows who have little support. And our average age of the group that we've had is 74, and about 40% male and about 60% female. And the next slide is actually a picture of Bob and Norma. That's actually my mom and dad, where loneliness kind of impacts my family, but taking a look at why it's so important for us to look at the caregivers, that 40 to 70% of caregivers experience a clinical depression that's actually coming from that isolation and impact of being that caregiver, that we know how important it has been to reach out to those. And then if you go to our next slide, our first year insight, it's been a little over a year, and so these were some of our earlier numbers. That 700 referrals are all those community-based resources that we're referring people to, or any programs to do that. And so one of the things that we're looking at is taking a look at what are their barriers and how that is impacting. And we have seen 11% reduction in acute costs. We've also seen a decline in going to emergency rooms, about 5%. But the statistic I love, because I see the overall effect, is we've had an increase of 53% of people in our program that were not exercising before that are now exercising. We've had over 15,000 calls to connect to all these people, but we've also seen a significant reduction in depression. Currently, we have over 900 in our program, and if you go to the next slide, it'll take a look where I was talking about the barriers. The top half of the slide is kind of looking at their barriers to socialization. And one of the things that in the first year I was working with a system where they could only pick one. And so this next year I will be excited to see we have a new data system where we can collect if it's more than just one reason why they're not isolating. And if they identified more than one, my staff kind of picked the one that was the biggest. And as you can see, 51%, the largest, was medical issues. And then we had such a large group of pain that we pulled that one out separately. And then there's a lot of grief and loss. I think it may be higher when we start tracking and seeing that we could track and follow more than one barrier. But the other thing that I wanted to talk just a little bit about, what were the barriers in developing our population program? And the first one is this is kind of an invisible population. They're hard to find. So we did initial outreach of about 1,100 of our members when they come in and they do a healthy start, that they had marked on their health risk assessment that they lived alone and they had poor to no social support. So that was our initial outreach. Then we went into where we actually sent out a letter to all our members and describing the program. And we had a very large number of members to self-referral into the program and continue. We had one person, it was almost 6 months after the letter went out, that they had been holding on to the letter, and they were just embarrassed and felt embarrassed to say that they were lonely and they needed someone to talk to. And another thing is just the lack of education, not only among the community, but in healthcare in general. And so educating our clinicians, educating people in our member services if someone calls in that they may be lonely. And then we also worked in having community forums because of the lack of education in the community. And I'm really excited that we're having a webinar like today that we can really kind of increase that. So those have been some of the challenges and things that we come to. One of the things is we're also, the next slide is a picture of how we're now changing in our care centers. We're redesigning to have a social space actually within our care setting. And so you're seeing here guitar lessons. And Mike is the one there in the center. He used to come into the care center on Mondays and just bring his guitar. And we now have a social connector in the care center. So when people are coming in for their health appointments, that we kind of engage them in these social activities. You can kind of see the table there with puzzles, have games. So we have structured social groups where we're bringing people in, things like Techie Tuesday, where, believe it or not, some of the things they want to come in is learn how to text a picture on their phone back to their grandkids. And so I'm trying to help them find ways that through technology that they can get more connected. And then Mike's wife is there. She also started a crocheting class that they're actually making beanies for people getting chemo and lap blankets for people in hospice. So really helping them connect and find that kind of meaning and purpose. And then if you go to the next slide, kind of wrapping up is, what can we all do today that we want to have a program or things like this? Well, one is just really talking about the issue with your friends and family and your loved ones, patients, providers, really getting the word out there why it's so important for us to really connect. And then the other thing is really helping people connect to their purpose and meaning in life. One of the gentlemen that I talked to probably in the first 100 phone calls that I made and kind of coming up with how we're going to create this program, it was really clear that he had lost his meaning and purpose in life. And that story previously, the previous slide of Mike, he said it's given him purpose and meaning now that he's teaching other people how to play guitar. It's not just him coming in, but he feels like he's making a difference in someone's life, and that's made him healthier and want to take better care of himself. And then the last thing is just reaching out to people in the community. Maybe if it's just you're in a restaurant and you see someone eating alone, you might go over and say, hey, would you like to join me? But that's really kind of, I call the secret sauce of our program is that power and that human connection that has really had that impact on our members' lives in so many ways. So that's kind of wrapping it up. I'm hoping all of us after today can think about just when you see someone alone out there in the community that we all can make a difference. And it's something I think a lot of times in healthcare, we can talk ourselves out of doing something that think that it sounds too complicated. We can't do that. But it is something that we can address in healthcare, and it's time that we do. And I know the UK just had a big conference that Julianne was able to attend that we now need to advocate for those same types of programs and things that we can do and make a difference here in the U.S. Catherine, I'll turn it back over to you.